Okay, now I already did a video where I talked about how to get the most or how to make the most out of your level 1 fieldwork. So this video this video is like a part 2 of that. So this video we are going to talk about the level 2s and how to make the most out of your level 2 fieldwork. So level 1s and level 2 fieldworks are very, very different, and so it's going to require a lot of different skill sets and a lot of different tips, and so I thought that 2 different videos would be a lot better. All right, so you made it to level 2. Yay! I feel like when I was in level 2 was like my last, it wasn't my last step. I did my level 2 fieldwork and then I went back to school for my last semester and then I graduated. So if you are doing your level 2s, congratulations that you made it this far, and I am rooting for you. Now, these tips should help you so you can make the most out of your level 2 fieldwork. Let's go. You are expected to do a lot more. So you have a lot more responsibilities in your level 2 fieldworks than your level 1s. And rightfully so, because you are about to graduate, you are about to start practicing as your own independent clinician. So they need to make sure that you have the skill sets that you need in order to transition from a student to being a clinician. Now, I always say this in a lot of my videos, and I'm going to say it again in this video if you have missed it. If you know what kind of population that you want to work with, what kind of setting that you want to work in, make sure or try your hardest to pick a level 2 fieldwork or level 2 settings that's going to be in alignment with that. Meaning, when I did my level 2 fieldwork, I make sure that I picked, so I did 2 settings with my level 2s. I did two level 2s. So I made sure that at least one of them, well, both of them ended up being in a setting that I wouldn't mind working as a clinician. And I made sure I did that because I wanted to have a very smooth transition as a new grad. So I made sure that my first job as a new grad was in a setting that I completed one of my level 2 fieldworks in. So I did my skilled nursing facility level 2 and I got a job in a skilled nursing facility as a new grad. It made it 10 times easier and very smooth transition for me. So your level 2s would be your mini training as a clinician. Okay, you're going to be able to do a lot more hands-on with your patients. At some point, you are going to be the one treating your patients independently by yourself. Okay, so it's some serious stuff, and you have to pass your level 2 fieldworks in order for you to graduate. So keep that in mind as well. So some of the things that you can do to get yourself ready is to build a folder, put together a folder of relevant information that you can reference while you are in your level 2 fieldwork. So if you know the setting that you're going to and the population that you're going to be working with, printing out like different like common diagnosis and the different symptoms that you can expect, printing out like different precautions, print out like vital signs and what is normal and what is not, like things that you can easily like reference and look at. What is the normal range of motion, and you know how to measure range of motions, like different things like that. Anything that will make it very easy for you to have access to the information that you need, especially when you need it. Okay, have very relevant information in a folder. I may or may not do, maybe sometime down the line, maybe I'll do an example of what a skilled nursing facility fieldwork level 2 folder can possibly look like, and I can share that with you guys. If you're interested in something like that, let me know down below and I can add it to my filming to-do list. Okay, if you don't have step-by-step way to do your evaluations at hand when you start your level 2 fieldwork, you can look at your CI, do it like a couple times and write it down as you're doing it so you can have a blueprint for yourself once you start doing it independently by yourself. Okay, so that would be a good thing to have. You can have in that folder like an example of like documentation, like how to document different phrases to use when you document and things like that. Examples of like different goals and how to write different goals. You can have that. That would be really good to have. Even now, I still have like different like favorite goals that I love to write, like when it comes to like splinting and different things. I have like blueprint goal that I like what do you call it, like a goal template in my phone that I use for different things. Another thing that you can include in your level 2 fieldwork folder or binder is your rubric. So if your CI don't provide a rubric for you, ask your school if they have a Fieldwork level 2 rubric that you can have, that you can keep to make sure that you are doing everything that is expected of you in order for you to pass. And also a notebook. So if you can take a notebook with you, you can take that with you, or if you can have a paper in your folder or binder where you can write and jot down certain things that come up. I still reference to some of the notes that I took when I was a level 2 Fieldwork student, because certain things come up and I'm like, oh, I forgot about that, and I can go back and reference to that. So those are really helpful. So have some kind of book or some kind of, even if it's your phone, but be careful when you use your phone when you're doing your level 2 Fieldwork, like I already mentioned in my level 1 video, because you don't want to give off the wrong impression that you are on your phone. If you're going to be using your phone to take your notes, make sure that this is okay with your CI before you do it, just to avoid all of that. Just a good old notebook and just write things down. There's nothing wrong with doing that. You know, I know phones make things a lot easier, but you just want to play it safe as possible. Be as safe as possible when you're doing your level 2 Fieldwork. If it doesn't sound right, if it doesn't seem right, if it seems too difficult, if it seems like it just doesn't make sense, don't do it, because the last thing that you want to do is to be unsafe with your patients. That's like the fastest way to fail your level 2 Fieldwork is to be unsafe with your patients. I'm telling you. So be safe with your patients. Have that gate built on. Be right next to them. Another thing that you need to do is to have weekly meetings with your CI. These weekly meetings for me allowed me to go over what I was having difficulty with, and to also make sure that me and my CI were on the same page about how I was doing and how things were going. You don't want to wait till like midterm to find out that you're not doing so well, and now you have to start all over again at a different setting. So having those weekly meetings will allow you to make sure that you and your CI are on the same page as to how things are going. It also gives you the opportunity to ask questions. So that's another thing that you can also do. Write down any questions that may have come up while you're treating the patient, while your CI was treating the patient, because sometimes certain things come up that you don't have the time to ask at that particular time. But if you have a page where you've written down all your questions, when you have your weekly reviews with your CI, you can go ahead and ask them those questions so that you don't miss a beat, okay? And also when you're doing your weekly meetings with your CI, make sure that you ask them what their goals are for you for the following week, so that you make sure that you work on that together. Okay, make sure that you ask questions. Okay, please, for the love of God, ask questions. Whatever questions that you have, don't be scared to ask them. You are still a student and you are still learning, trying to be the best clinician that you can be. And you cannot do that if you cannot ask questions about difficult things that you don't understand, or if you are not able to do certain things. And shame on the CIs who make it hard for students to be open up and to be comfortable enough to ask them questions. You need to create an environment that makes it easy for your students to ask you questions, okay? So please create a really good environment for your students to be able to do that, because they are still learning and they are doing their level 2 Fieldwork so that they can learn even more. So make sure that you allow them the openness, okay, and the availability to be able to ask questions and to receive feedback in a very positive environment. Okay, now the next thing that I'm going to say is treat it like a job, okay? Treat it like it's a job. And I feel like this is the most obvious thing. This is a job that's going to earn you a grade, and also is going to give you your first-hand experience as a clinician. So take it serious, treat it like a job, be professional, be on time, dress professionally. Ask them what the dress code is and be ready for that as well. That's something that you can definitely ask your CI before you get there, what the dress code is. They're probably going to give you a little interview. If they don't give you an interview, you can definitely call them and ask them like different diagnoses that they see, what the expectation is, what they need you to bring, anything like that, so that you can be ready for your first day as a level 2 Fieldwork student, okay? And this, I'm going to say something, and I hope that it doesn't come off wrong. It's not really a wrong thing, but you know how people are these days. So if you are in a setting working with a CI and you feel like things are not going how you anticipated them to go. If you feel like it's not a really good, positive learning environment for you, you're not getting anything out of it, your CI is not taking it serious, or it's just not a good fit for you, make sure that you let someone know as soon as possible. So let your school know, let your CI know. Be honest with yourself about what's going on, because I would hate for you to just hold it all in, don't say nothing, and then failing. And then you have to do it all over again. Nobody wants to do 3 months again, okay? So make sure that you let your school know, because they can change your fieldwork settings or sites if able. A lot of schools can do that for you and provide that for you. So if it's not going well, it's better for you to change your settings, to change CIs, than to endure it and be all stressed out. Because like I already mentioned, stress does not help with learning. It really doesn't. So if it's just not going well, it's better for you to just let your school know so you can change sites. Okay? Now let's go on to the last and final tip. Always send a thank you note or a thank you gift to your CI or to the therapy staff that allowed you to come there and be a part of their team. Just show your appreciation for them taking their time out to do this for you. So, and I hope this video was helpful. If it was, thumbs up, like, comment, and subscribe, and I'll see you guys in the next video. Bye.